Thank you, Madam Chair. This has been interesting. I've enjoyed this. Thank you very much. I've been a mental health coach all my life. Most of you probably know I coached and taught for the last 40 years. And I thought I was a football coach, but I turned into a mental health coach for the last 10, 12 years. I don't think even my colleagues here really understand the problem that we're having. And it's getting worse in our communities, in our schools. And I want to thank y'all for your help and what you do. It's hard. It really is. And it's great to hear the identification part. You got to be able to identify a problem before you can solve it. And we have so many problems. I did. My staff did. Our medical staff did. And, you know, the problem that I see coming, we're not going to be able to print enough money to pay for mental health programs in the future. Number one, if we don't do something about our border, we have drugs coming across the border that is unbelievable. And it's amazing to me that we continue to talk about problems, and when we don't stop the occurrence of problems that are the main problem to begin with. But it starts with family. 70% of minorities that I coached had one or no parent. And I think a lot of you agree with that. It starts in the nuclear family, and we're still trying to tear that down. But there's a lot of things that we can address, but it all goes back just to identification and understanding the problems that we're having in terms of addiction. You know, I see one of the addictions that we have, and I hope somebody would agree with this. We have alcohol, we have drugs. Social media addiction was absolutely a huge problem on the kids that I coached. Huge problem, because they were addicted to it. There were bullying. There were problems that we had to face every day. And I had to put special rules in for social media. But that being said, I want to tell you a little bit about something we're doing in Alabama that's actually working. Now, we got a problem, and we're trying to solve it. And we basically took our money in Alabama, and we said, what we're doing is not working. And so we started a broader area, and it was the mental health problem was just going over the top. So we took our mental health and we set it up in the crisis centers all over the state, different regions. And we included the EMS, we included our law enforcement, we included the teachers and everybody in the area. And what we did is we identified the kids or the adults that had mental problems or addiction problems, and we got them to those crisis centers. And it was somewhere that they were away from their classmates, because sometimes you can't work if you're close to the classmates. You know, they're embarrassed, they won't go, and Alabama's making a huge step forward in our mental health problem. Now, it's not the answer, but you know, I want to ask some of y'all, what can be done on the federal level to incentivize programs like this to help? Ms. Goldsby, what do you think?
Senator, it's an excellent question. And I think we can look to prevention as an answer. The Substance Abuse Prevention and Treatment Block Grant through SAMHSA supports states in disseminating evidence-based prevention work. And we do this with our communities by supporting coalitions that use the strategic prevention framework to work with stakeholders at the local level to build protective factors and reduce risk factors to protect our kids so that we're not letting them escalate to crisis. And to your point, Senator, that takes parents, that takes school districts, that takes coaches, that takes law enforcement and our healthcare leaders to address the local needs for our children. And so we just want to say again that the Substance Abuse Prevention and Treatment Block Grant is a huge support for that work in our state and in other states.
Yeah, I started noticing more and more in the last 10 years, we were giving out more drugs, way too many drugs to our kids for attention deficit, anxiety. I had actually had to intervene with kids that were bringing drugs from their hometowns to our college campuses and giving it to our doctors to make sure that they were giving it out properly. A lot of these kids don't take it properly, and it needs to be a better regimen of how to do that. But I want to thank you again. I don't have another question. Just thank you for what you're doing. again, it's about money, but at the end of the day, it comes down to people, and we need more people in education that gets into mental health. And if we don't do that, we're not going to have enough people to be able to answer these problems as they arise down the road, because they're going to get worse and worse. So thank you very much for what you do and for being here today. Thank you.
Thank you.